So this is first video about prediabetes. Here we are going to discuss about introduction of prediabetes, insulin function, prediabetes development, diagnosis, limitations of diagnosis, question and answers. So prediabetes is a medical condition where our body glucose reserves are higher than the normal but do not reach or exceed the diabetic limits. Having prediabetes is a risk factor of development of type 2 diabetes, which is a chronic illness. It's a kind of slow poison that can lead to serious health issues like kidney failure, heart attack, and stroke. Let's understand prediabetes by an example. Suppose a patient has blood glucose level 120 milligram per deciliter, which is more than the normal limit and less than the diabetes value. So the result is falling between 100 to 125 milligram per deciliter, which is a pre-diabetes zone. It's a gray zone. So that's why this patient has pre-diabetes. If we discuss about blood sugar and diabetes, and we don't speak about insulin, the discussion will not make any sense. So therefore, we have to first understand insulin role in glucose metabolism. When we eat food, glucose enters to our bloodstream, travels to the pancreas, and then finally enters the beta cells. Beta cells are responsible for producing insulin and releasing it into bloodstream. The insulin then travels to certain type of cells such as adipocytes, hepatocytes, and muscle cells. Adipocytes are fat cells, hepatocytes liver cells, and then muscle cells. These all cells have specific receptors for insulin on their surface. So insulin travels to these cells, attaches to these cells, and then allow glucose penetrate the cell. So how prediabetes develops? In prediabetes, our body cells, as we already discussed about adipocytes, hepatocytes, and muscle cells, do not respond well to insulin. They become resistant to insulin. This condition is well known as insulin resistance. We will talk about insulin resistance in our upcoming videos, which is a leading cause of developing type 2 diabetes. Limitation of diagnosis means some of the factors they affect on the results. So maybe results are not accurate, which can be due to age factor like pancreas efficiency of producing insulin reduces with age. So there is a chance of having a few higher results in older patients. Then the other factor is dawn phenomenon. When we sleep during the early morning hours, our body produces hormones. These hormones such as cortisol, growth hormone, and catecholamines stimulate production of glucose in the liver, resulting in increased blood glucose levels. So you can imagine we don't eat anything, but our blood glucose levels are getting higher because of dawn phenomenon. Like in the fasting state when we are going for testing, so maybe our results are a little bit higher because of dawn phenomenon. So diagnosis of prediabetes is done through HbA1c, fasting blood glucose, and OGTT test. HbA1c doesn't require fasting. It provides an average of blood glucose levels over the past 2 to 3 months. Below 5.7% is normal. 5.7 to 6.4% is prediabetes, and 6.5% or above is diabetic range. Fasting blood glucose requires 8 to 12 hours fasting. You can drink plain water. Less than 100 milligram per deciliter is normal. 100 milligram to 120 milligram per deciliter Prediabetes, 126 milligram per deciliter or above is diabetic value. In oral glucose tolerance test, patient requires 8 to 10 hours fasting. Then you will drink 75 gram glucose liquid. The second sample will be collected after 2 hours. The first sample will be collected in fasting state, but we need results after 2 hours, which should be less than 140 milligram per deciliter. Otherwise, it could be pre-diabetes or diabetes range, which is pre-diabetes 140 milligram to 199 and diabetes 200 milligram or above. So these are some questions and their answers. What are the risk factors of pre-diabetes? First of all, family history of having type 2 diabetes. Maybe one of the family members have diabetes, so there is a chance of having diabetes in their family. Overweight or having fats around the body is another factor. Unhealthy lifestyle like eating unhealthy food, lack of physical activities. These all are risk factors of prediabetes. Is this life-threatening disease or condition? Not at all. By itself, prediabetes is not a big deal. But when it converts into diabetes, it can cause major health issues like heart attack, stroke, and kidney failure. Is prediabetes reversible? Yes. The good news is this is reversible. Prediabetes can be reverted by healthy lifestyle, exercise, diet, monitoring of blood glucose levels, and consultation with your physician. Do all the pre-diabetic patients develop diabetes? Not at all. According to the several studies, 50 to 70% of people develop diabetes. So there is a chance of having a little bit higher results but not developing diabetes. But gene, race, family, medical history of pre-diabetic patient is not in our control. When to see doctor? If your results are showing pre-diabetes, consult with your doctor for detailed and thorough investigation for final diagnosis. Which test is more sensitive? OGT test is more sensitive for the diagnosis of pre-diabetes. Which patient may not have pre-diabetes but results showing pre-diabetes? This is in older patient, as we have already discussed, and sometime maybe due to Down phenomena, the patient they have a little bit higher results. What to do if you have pre-diabetic results? Do not panic. Do not change your diet without consultation with your doctor. Monitor your glucose levels. Consult with your doctor for thorough investigation. Thank you so much for watching this video. If you like this video, please like, comment, and share this video. And the most important is subscribe, so that when I upload new videos, you will have notifications for those videos. Thank you so much.